In Health Watch, it's that time of year when we see more cases of respiratory illnesses like COVID, the flu, and RSV. KTX's reporter Brenna Gibbons joins us live from the Taylor County Public Health Department with more on the outlook this year. Brenna?
The director of nursing here says that COVID numbers are on the rise, with students returning to school and people coming back from their summer vacations.
So the COVID symptoms that we're seeing are milder than they were before. It doesn't mean that people aren't being hospitalized. There are still some hospitalizations, particularly among the elderly. As far as respiratory illness, RSV is also a concern, and that's going to affect both infants and elderly people.
Waller says they are encouraging people to get vaccinated for RSV and COVID if they have not been already.
All respiratory illness, you're going to experience that, potentially a sore throat, runny nose, headache. And the big difference with allergies is that's going to be sustained. If you have that for weeks and weeks and that's common for you, you're not running any fever, and it's just an ongoing thing, then you know that that's going to be your seasonal allergies. And but if you wake up one day and you are feeling achy, you've spiked a fever, and it's like a sudden onset kind of thing, that's more likely an acute illness.
If you're diagnosed with one of these illnesses, there are a couple things to make sure to do.
So CDC recommends that you stay home until you are fever-free without the use of medications. You want to be fever-free without the use of medications, regulating that for at least 24 hours. You want your symptoms to be improving, and make sure that you don't have a severe sore throat, cough, diarrhea, and then of course that your fever is also gone for at least 24 hours. And that will help prevent the spread to other people, especially people that are vulnerable.
Waller says the people who are most vulnerable are the elderly, infants, and people with compromised immune systems. Live in Abilene, I'm Brenna Gibbons, KTX's News.